Hi there, science fans. Welcome to another episode of Science and Other Stuff for Senior Citizens. My name is Dan Casciano. If you like these COVID-19 videos, please subscribe to my channel and ring the bell to be informed of future videos. During the past year, there have been many discussions of the potential value of over-the-counter medications as modifiers of the COVID-19 infection pathway. Several come to mind, including zinc, vitamin C, and vitamin D. In today's brief video, I will be describing some of the observational and clinical studies investigating whether vitamin D, in fact, alters the COVID-19 infection pathway and/or alters the severity of that disease. I will also present data from two studies, one that is observational or correlative in nature, and one that is a small bona fide clinical study. First, here are a few known functions of vitamin D. The only proven benefit of vitamin D is its requirement for absorption of calcium to build strong bones. There are observational benefits that include boosting the immune and neuromuscular systems, and its deficiency has been linked to several cancers as listed in the third bullet point. As already mentioned, there are anecdotal and correlation studies that suggest that vitamin D may prevent COVID-19 infection and may decrease the severity of disease in COVID-infected humans. This slide presents the motivation for the present video. There are many association and correlative studies that support the benefit of vitamin D for COVID patients. Recently, a double-blind clinical study investigating whether vitamin D affects COVID-19 infectivity and/or severity was conducted, in which the data are compelling enough to strongly indicate the need for a full-blown phase 1, 2, and 3 human clinical study. In a future video, I will describe what constitutes such a clinical study. Before I describe those studies, I thought I would preface it with the information presented in this slide. These data are somewhat shocking, especially since we can supplement these deficiencies with a cheap, readily available over-the-counter container of vitamin D3. 42% of the U.S. population are vitamin D deficient. 82% of Black Americans and 70% of Hispanic Americans are vitamin D deficient. The CDC has accumulated data that indicate that Black and Hispanic Americans are around 5 times more apt to die of COVID infection than do whites. The objective of this recent study was to examine whether the last vitamin D status before COVID-19 testing is associated with a COVID-19 test result. In this correlation study, the investigators identified a number of patients whose vitamin D blood levels were measured in the previous year. These patients were then divided into those who were vitamin D deficient and those who were not. In this single-center retrospective study, patients who were deficient in vitamin D were almost twice as likely to test positive for COVID-19 than patients whose status was vitamin D sufficient. The authors of this study indicate that this finding strongly suggests that randomized clinical trials are needed to determine whether vitamin D affects COVID-19 risk. The next several slides present data from a recent randomized double-blind clinical study. Before describing the study protocol, I thought I'd address why the authors chose to treat the patients with an analog of vitamin D3, namely calcifediol. Vitamin D3 is not the active form of the vitamin, and it requires metabolism to that active form. This slide indicates the metabolism of vitamin D3 to the activated form of vitamin D3, that is, the molecule that performs the vitamin's function in the body. When one takes a vitamin D3 capsule orally, it is absorbed in the gut and is transported in the blood to the liver, where it is metabolized to 25-hydroxyvitamin D3, which is then further metabolized in the kidney to the active form, 1,25-dihydroxyvitamin D3. This process usually takes a few days. The authors of the clinical study, however, use the vitamin D3 analog calcifediol because it is immediately transformed to the active form of vitamin D3. The reasons for this is described in the next slide. This slide represents the protocol followed by the authors of this study. 76 patients with acute respiratory disease syndrome confirmed by X-ray analysis and testing positive for COVID-19 were identified. The 76 patients all were placed on the hospital's proven standardized treatment given to all COVID-19 patients at the time of this study. They then were randomized either to a group receiving calcifidol, there were 50 patients in this group, or not receiving calcifidol, there were 26 patients in this group. These patients were hospitalized but not yet occupying an intensive care unit. The patients receiving calcifidol were given a dose of 532 micrograms on the first 2 days, then 266 micrograms on day 3 and day 7, and then once a week until discharged from the hospital. The results were one of the calcifidol patients required admission, with none of them dying, while 13 of the patients not receiving calcifidol required admission to the ICU, and 2 of those died. This study showed that an analog of vitamin D3 appeared to reduce the severity of the COVID-19 pathway. The conclusions of these studies strongly suggest that vitamin D3 may be a useful treatment for patients suffering from COVID-19, resulting in decreasing the severity of COVID-19 pathway and death. The association studies indicate that vitamin D3 deficient patients have a higher level of infection and higher levels of hospitalization and ICU admissions. The clinical study showed vitamin D3 reduce acute respiratory distress syndrome as well as intensive care admissions and mortality. These and other studies strongly indicate that a phase 3 clinical study with thousands of patients who represent all age groups as well as groups with comorbidities must be done to determine the true value of vitamin D3 effectiveness in fighting COVID-19. Here are the references for the 2 studies described for those of you who wish to read these studies, as well as a large observational study conducted in Israel. For more information about science, visit my website at www.dcasciano.com. If you have any questions or would like me to develop a video on a specific science subject, leave them in the comments below or email me at dan@dcasciano.com. Be sure to like this video and subscribe to my channel and ring the bell so you can be informed when I upload a new video. Thank you for watching Science and Other Stuff for Senior Citizens.